Good morning. How are you doing?
I'm good. How are you?
Doing well. My name's Haley. I'm a student nurse. Can you tell me your name and date of birth?
Carly Secretary, 127, 2008.
Thank you. May I see your wristband, please? Thank you, ma'am. Alright, so I started off by performing my hand hygiene, putting on gloves, and verifying my patient using two identifiers, her name and date of birth and her wristband. So I'm going to start off my assessment by getting a full set of vitals, which includes respiratory rate, heart rate, blood pressure, O2 sat, and temperature. My gloves on. So I'm going to start off with blood pressure. Do you have a preference on which arm?
I do not.
So this, I'm going to make sure it's right above the brachial artery. Also want to make sure that there's enough room for at least 2 fingers to go through. And is that too tight for you? Or is that okay?
That feels good.
Also signing. So I'm going to start off by just filling the patient's breathing artery, and then pumping up her blood pressure up. And push your toes down. Okay, perfect. So patients, so it stopped around 100. So now we're just going to listen to the brachial artery and then load up to about 130, 140. And then when we hear the sound again, that is the systolic. And when we don't hear it anymore, that is the diastolic number. So I got a blood pressure around 118 over 70, so that is within the normal range. She's not hypertensive or hypotensive. So now I'm just going to get my patient's temperature. Just gonna have you open the line for me. I'm gonna stick this right under your tongue, okay? So I got a temperature of 98.1, so that is within normal limits, and she is in an afebrile state. So now I'm going to get my patient's heart rate. I'm just going to borrow your pulses. And also, while I'm doing this, I'm just going to compare on both sides, and they are 2+ bilaterally. Nice and strong.
You think so? Yeah. Because like right here, I think she'd be able to see it. And like for GI, she'd be able to see it.
So I got a heart rate of 60 beats per minute and then a respiratory rate of 16 breaths per minute. So those are both within the normal limits. No signs of bradycardia or tachycardia or tachypnea or bradypnea. It's normal. Alright. So I would also get an O2 sat on my patient with a pulse ox, and the O2 sat should be between 92 and 100%. Shows good oxygen circulating throughout the body. Okay. So now that we're done with vital signs, I'm going to move on to the neuro part of the assessment. So I'm first going to start off with just a couple of questions. Do you know where you are right now?
Yes, I'm at Georgia College.
Perfect. Do you know what day of the week it is?
It is Wednesday.
What holiday just passed?
Thanksgiving.
Did. And do you know who the president is?
Biden.
So my patient is awake, alert, and oriented times 4. She's oriented to time, place, person, and event. And she does not appear to be in any type of distress or anything. Are you in any type of pain? No. Perfect. Her speech is clear. Her affect is appropriate. And her posture is nice and straight and aligned. Her clothes are appropriate for the weather. Her skin color is appropriate for race. Her hygiene appears to be intact. And her mood seems to be appropriate. So now I'm just gonna shine a bright light in your eyes. Just look at your pupils. Can you follow them? So my patient's pupils were equal, round, reactive to light, and accommodation. They were measuring 3 millimeters bilaterally, and they consented to both direct consent and consent. They responded to both direct and consensual responses. And while I was looking, her sclera was also nice and white, no signs of redness, jaundice, or anything like that. Okay, so now I'm just gonna look into your nose really quick. Good. All right, can you hold one side of your nose and blow out the other side? So are you having like sinus issues or anything going on? So patient's nose was nice and patent bilaterally. Do you use any contacts or glasses?
I wear contacts.
And are you hard of hearing in either ear or use any hearing aids or anything?
No.
Perfect. So patient's hearing is intact and she uses contacts or corrective lenses to help her vision. Can you give me a nice big smile? Good. Open wide. So patient's oral cavity was intact. Her face is also symmetrical. I didn't see any signs of drooping or facial paralysis, which we would see in a patient who suffered a stroke. And I also didn't see any dentures, lesions, or any missing teeth in her oral cavity. So we are good there. All right. So now I'm just going to move down to the heart. And as mentioned with the vitals, her heart rate was 60 beats per minute, which is normal. And so now I'm just going to give it a listen. And I'm going to start off with the aortic valve, and I'm going to make my way around. And in a normal patient, we would go under the gown, and it would be a skin-to-skin contact. But for video purposes, we're just going to leave the shirt on. I'm going to start at the aortic valve.
Before we do anything, just stand up, please, and
Hold on. Tricuspid and mitral. Now I'm just going to flip around, make sure I don't hear any murmurs or anything. Same thing, aorta. Hold on it. Herbs point. Tricuspid. And mitral. Alright, so S1 and S2 were both noted. I didn't hear any extra heart sounds, and I also didn't hear any murmurs or anything. And no, which would be a sign of AFib or dysarrhythmia, so none of that. So I'm just going to check her capacity on your fingers. And this just measures the perfusion to her tissues in her fingers, and it should be under 3 seconds, which it was. And we would also do this to the toes to make sure that oxygen was being perfused and blood was being perfused down to the toes as well. Okay. So I've already checked the radial pulses, and they were 2+ bilaterally. So I'm just going to do the breathing. 2+ bilaterally, looking good. And now I'm just going to do your popliteal. 2+ bilaterally, and now the pedal pulses. 2+ bilaterally. So pulses were nice and strong throughout the body. So now that we're done with the heart, I'm going to go down to respiratory. And just by inspecting, my patient's chest is nice and symmetrical. She doesn't appear to be in any type of respiratory distress. She's not using any accessory muscles such as the trachea or her stomach to help her breathe. She doesn't have any endotracheal tubes or drains, nothing like that. So now I'm just going to give it a listen. I'm going to start with the anterior side and then I'm going to move to the posterior. When you feel my stethoscope, just take a deep breath in and out, okay? We're going to start with the right upper lobe. In, out, good. In, out, good. In, out, good. Out, good. In, out, in, out. Now the lateral side. In, out,
So say when you do it,
out. Now I'm going to move back to the posterior.
patients overview.
Same thing, right upper lobe. In, out, in, out,
Whether
out,
her body position is appropriate, also for using
Out.
any
in.
extra muscles
Out.
or extra
Now the lateral side.
use of
In,
anything to
out,
get going where she's
and
going.
one more.
I'm
In.
gonna assess your gaze. So could you say
Alright,
that
so my patient's respiratory rate was 16 breaths per minute, as mentioned in the vitals. And I didn't hear any signs of wheezing, crackles, stridor, no, which would be signs of fluid or pneumonia or COPD. Didn't hear any of that. They were present and clear. She's also not barrel chested, which we would see in a patient with COPD. She's sitting straight up. So now that we're done with respiratory, I'm going to move down to GI. First, I'm just going to ask you a couple questions. Do you know when your last bowel movement was? Perfect. And do you have any nausea, vomiting, diarrhea, and constipation? I do not. Perfect. Alright. So now I'm just going to have you lay down. And just by inspecting my patient's abdomen, it's nice and flat. There's no signs of abdominal distension, and she also doesn't seem to be in any type of abdominal distress. So we would always, we're going to move on to auscultation, and we always auscultate before we palpate because we don't want to move anything around. And if I hear any abnormal sounds, it's important to listen for at least 1 minute. And for video purposes, we're just going to leave the shirt on, but in patients, we would lift up the gown, skin to skin. We're going to start with the right lower quadrant. I'm just going to flip around and listen for murmurs. Alright, so patients' bowel sounds were present in each quadrant. I didn't hear any hyperactive or hypoactive bowel sounds. So now we're just going to move on to some light palpation. If you feel any pain anywhere, just let me know, okay? We're going to start in the right lower quadrant. Any pain? Upper? No. Left upper? No. Left lower? No. Now we're going to move on to deep palpation, and we would admit this in a patient with suspected appendicitis or cholecystitis because we do not want to rupture it.
And
Any pain? No. Any pain? No.
And that was
Alright, so patient's abdomen was non-tender during both light palpation and deep palpation. And I didn't feel any knots, any obvious nodules or anything. So we are good there. So now I'm going to move down to GU, and I can see, just by inspecting, I can see that my patient does not have a catheter in place. She's voiding. How is your urine? Is it clear, cloudy? Clear and yellow? Perfect. And do you have any burning or anything when you urinate? And it's not too frequent or anything? No. Perfect. Alright, so now we're going to move down to skin. I'm just going to feel. And patient's skin is nice and warm to the touch on both the arms and the legs, which means the blood is flowing. Her skin color is appropriate to race. I don't see any signs of cyanosis, jaundice, or arrhythmia or anything like that. And I also don't see any obvious wounds, any drains, and she doesn't have any IVs. If we were to see any wounds, drains, or IVs, we would want to assess the dressing, assess any drainage or anything, and for the IV, we would want to assess the type of IV, where it was, if it flushed easily, and if it was aspirating any blood or anything. She doesn't have that. So now I'm going to go down to the musculoskeletal. I'm first going to have you grip my hands. Good. Alright, her hand grips were nice and strong, about a 5 on the strength scale. Do you use any assistive devices such as a cane, walker, or anything to help you walk? And I'm just going to have you walk straight ahead. I'm going to assess your gait. Good. Alright, so my patient's gait was appropriate. I don't see any signs of Parkinsonian shuffle, no leaning over or anything, and her posture is appropriate. It's nice and straight, no signs of lordosis, scoliosis, kyphosis, or anything like that. I'm going to have you lay down one more time. And we're going to assess your pedal pushes and pulls. And I'm going to have you press on the gas. Pull back. Good. So her pedal pushes and pulls were nice and strong. No weakness or anything. Can you flex your arm? Can you extend them? Can you do it with your legs? Good. Perfect. So she's also able to both flex and extend her arms and legs, and her motor function is also good on all extremities. All right. And we would also get our patient's height and weight at some point in the assessment, but her height and weight are appropriate to her body stature. All right, I think I'm done. Do you have any questions?
I do not.
Perfect. Thank you.